Hi, I'm Audra Burns from Dartmouth-Hitchcock, and welcome to the seventh in our webinar series, Heads Up, Coping Through COVID-19. Today, we will discuss financial hardships that families may be experiencing due to the ongoing pandemic and ways families can cope. If you have questions for our experts, they can be submitted to social@hitchcock.org or comment in the thread below. If we do not get your question in time, we will be answering them in the comments as well as on an FAQ page on our website afterwards. I'm joined this afternoon by Bryan L'Heureux, Community Health Partnerships Coordinator at Dartmouth-Hitchcock, Dr. Mirella Maggi, Clinical Psychologist, and Dr. Eric Wadsworth, Co-Director of Dartmouth-Hitchcock's Financial Fitness Advisors. Thank you, all of you, for joining me today.
Thank you.
Thanks for having us.
So, Bryan, how are families being impacted financially by this pandemic?
That's a great question, Audra, and I really do think that it's affecting everyone a little bit differently. But what I can say is that we are experiencing some of the highest unemployment rates in recent history right now. For example, between March and April, unemployment rates for New Hampshire jumped from around 2.5% to 17.2%. And that's a huge jump and really just means that a lot more people are experiencing unemployment at this time, many of them for the first time, and that can be a really daunting situation to be in. Food pantries in some communities are serving up to 200% of their normal volume. Also, a lot of people are applying for unemployment assistance, which might cause delays and frustrations in processing. But with that in mind, I think it's important to remember that there are resources available to people financially impacted by COVID-19 as well. In many cases, funds are being distributed to community organizations that you might already know about, such as your local food pantries or your community action programs. One example of this is through Granite United Way, and you can check out what resources might be available through their COVID relief fund in your community on their website, and how to access them through those community organizations that I mentioned.
Yeah, and I think to add to what Bryan was saying, that this is a challenging time for families for many, many reasons. We know that unemployment and financial strain can lead to people feeling significant anxiety and worries, and that can lead to difficulties managing big emotions for every member of the family. So really attending to and supporting everyone's mental health is a really important part of coping with what's going on right now.
Yeah, and in addition to job loss, we have several families who are looking not at job loss, but reductions in income. Hours have been cut, opportunities for new jobs, business isn't coming in as often. And in addition, folks are worried about investments that have been hit. Retirees looking at accounts wither, folks approaching retirement, looking at account balances that were looking quite strong at the end of the year. Have been hit pretty hard by stock market misbehavior.
And I think, Bryan, what you said about the fact that food pantries are serving up to 200% more, I think this would be a great time for those who aren't as financially impacted. Now's the time to really support your local food pantry because clearly they are helping out a lot more than they're used to. So now's a great time to donate if you're able to.
Definitely.
So, Dr. Wadsworth, if someone in the household has lost their job, been furloughed, or taken a pay cut, how can the family cope with the sudden loss of income?
Well, when you think of the categories you have to work with, we've got opportunities on both the revenue side and the expense side. We can work on income, we can work on expenses, and we have assets. Sometimes we can sell assets or borrow against assets. Interestingly, the CARE Act passed by Congress in mid-March really worked on all four of those. The headline provision was extension of unemployment benefits, turbocharged by federal support, both in the amount of coverage and the length of coverage. And as Bryan mentioned, people should be signing up for those benefits that they're eligible for. In terms of the expense side, there are provisions for relief on both mortgage debt repayment and school loan debt repayment. On the mortgage side, we've seen a little bit of variability in the implementation, so you want to talk to your banker to your lender, how do these provisions apply to you, and what will it look like? And you definitely want to get in and have that conversation before you miss a payment. Loan officers have much more flexibility to negotiate when you're current on payments as opposed to in arrears. In addition, the CARE Act has several provisions loosening access to retirement assets, both accessing the assets earlier and without penalties, and also borrowing against them, which is, I think, an important provision because that means you can get access to the assets, but then replace them so they're back eventually growing for your retirement. The final point, not in the CARES Act, but credit card companies are expecting much higher call volume, asking for relief, and they are stepping up to that and prepared to discuss. But once again, you want to have that conversation before you're behind on payments.
Those are all really great points, Dr. Wadsworth. And if I could just add to that, I would say also think about making a plan about how you're going to manage some of this, just those basic needs, right? For example, as you mentioned, people might be receiving federal pandemic unemployment compensation right now, or that extra $600 that they're seeing in unemployment checks. Set some of that money aside just to make sure that you can pay for your rent in the future when those additional funds might not be available anymore. And just like Dr. Wadsworth mentioned, think about talking to your landlord or to your mortgage company. Also, know where your local food resources are and how to access them. For example, in the Upper Valley region, we have an organization called Upper Valley Strong, and they're doing a really great job posting all kinds of these available food resources for the Upper Valley, as well as a lot of other important resources on their website. Folks can look into similar organizations that might be available where they live, and I believe that we might have some examples of those on the website as well.
Yes, definitely. We will be posting them in the comments as well as on our website. And great advice for making a plan. And Dr. Wadsworth, what you said about, don't wait till you're behind. Make those calls now so that you can get the relief if you need it. So Dr. Maggi, I'm a parent. I have 2 kids at home who definitely have elephant ears and have definitely overheard my husband and I talking about our finances. So how can parents talk to their children about financial concerns and help them if they seem like they're experiencing anxiety about money?
I think this is a question that a lot of caregivers and parents are thinking about right now. One of the first things that I would say is that we really want to make sure that we're leaving the door open for our kids to come talk to us and encouraging them to bring us any feelings or worries that they may be experiencing during this time. Kids may not feel ready, excuse me, or they may not know how to talk to us about this, so we can start the conversation. So just by saying something like, I know that I've noticed that you've started to have a lot of worries about food, or I've noticed you've started to worry a lot about how we're spending our money. Can you help me understand what you're thinking and feeling right now? And if our kids do approach us, we can remember that, especially for younger kids, they might be asking us the same question over and over again in different ways as they're trying to process and make meaning about all of this. But we want to validate their emotions and their concerns. And we want to be honest while talking to them in ways that they understand and that are also developmentally appropriate. So using words and language that makes sense to them in the age that they're in. So in these conversations, though, we can talk to them about changes they might be seeing in how we're spending and saving money. Kind of like what you're talking about, if they're overhearing things, we can talk about maybe you've heard us talking about this a little bit more. What are you thinking about all of this? Or changes that they might be seeing as a result of a caregiver losing a job. But importantly, we want to make sure that kids know that their needs are going to be met and that the adults are working on this to make sure that those needs are met. It can also be helpful in these conversations to talk about how a lot of other families are learning how to manage their finances in different ways right now. And kind of as a last point, as I said earlier, this is a time of big changes for a lot of families, and that can bring about a lot of stress and tension. And sometimes acknowledging this can be an important part of the conversation too. As caregivers or parents, we can say to our kids, I have some big feelings about some of these changes as well, or I was really disappointed that we didn't get to spend our money on something that we were looking forward to too. You know, kids are often looking to us for how we manage our emotions. And during this time, we can model how to talk about these worries, how to talk about finances, and how to use positive coping skills. And we can really normalize and encourage them to talk about their feelings.
Yeah, I think it's also an opportunity for constructive discussion with kids. That is, uh, what sort of changes do they envision in expenses? For instance, um, camp might look different this summer, or the vacation might look different this summer, or allowances might be cut. And I think kids are willing to engage in that conversation. With a family business, sometimes kids are brought in to help. In the 2000 recession, we lost the receptionist in my tax practice, and my teenage daughter came in and manned the phone after school, and the little ones did shredding and copying. I think to Dr. Maggi's point, there's a teachable moment here. Envision a situation where we negotiate a 25% reduction in allowance, and then, you know, parents might say, look, mom and dad are going to do $1,000 gift to the local food bank. Do you want to be involved in that? And I can imagine the kid saying, Dad, I just took a 25% hit to my allowance, but the response might be, right, but you still have an allowance. And think about the long-lasting implications of that conversation.
That's great advice for parents, and definitely a teachable moment that we can all work on. So we had a viewer question come in through our email, and this is for all three of you. So what resources are available to support families and individuals who are experiencing financial hardships due to COVID-19? Bryan, let's start with you.
Sure, that's a great question. I would say 211 is a really great way, either calling 211 or going on to 211's website, to just begin the process of finding what resources might be available to you in your community. However, there are organizations who have people who can work with you one-on-one as well through that process of identifying and accessing these resources. For example, family resource centers in New Hampshire or parent-child centers in Vermont have people who are familiar with resources specific to your community, and they're really a huge help to families. Their support is comprehensive. They have tangible items like diapers and food. They also offer programming support such as parent education. Also, some primary care locations, such as those at Dartmouth-Hitchcock, have community health workers or resource specialists who can assist you with accessing food resources, signing up for Medicaid, or even helping with applying for utility assistance through your local town office.
Yeah, and those are great resources. One that I would add at a national level is the National Child Traumatic Stress Network. So if you go to their website, they have some resources for families about how to cope with this time, as well as coping with trauma more broadly. And one of the resources that I would say is that they offer advice for parents on how to talk to kids about emotions and worries, and how to have these honest conversations that we're talking about with our kids about what's going on right now, and how families are working together, and how to talk about these things.
I think it's also important, folks who are concerned about investment accounts, not to panic as the markets are gyrating and bouncing around. The website that we have is for Dartmouth-Hitchcock employees, but actually available to anyone in the community at ffadvisors.org. A number of tools there. But I think if you're worried about your investments, you want to talk to your investment advisor, to the custodian of your plan. Again, at Dartmouth-Hitchcock, that would be T. Rowe Price. They have a number of resources. You can come in and see the financial fitness advisors. I would frame it as, if you are young, don't worry about it. You're buying assets on sale. So keep investing. If you're much closer to retirement, you want to be really thoughtful about the allocation. Once again, talk to your financial fitness advisor, your investment advisor, and decide what's the right fit for you, and should you make changes, but don't make changes to investments in a panic.
I like that. Don't make changes in a panic. That's great advice. So we're just about out of time. So as we wrap up, I'd like to have each of you offer a few quick important points that you want those of us to take away as we're watching this. Bryan, let's start with you.
Sure. So I think that the overall message for me is that a lot of people are handling some hard and new situations, and it might feel overwhelming and stressful at times, but there are supports there to help you navigate through it, such as, like I mentioned, those 211 and the community organizations that I mentioned earlier.
Yeah, and I think to add to what Bryan is saying, that this is a stressful time for a lot of families, and families are facing new challenges and transitions. And when I think about kids and emotions and mental health, what we're really looking for is to help our kids feel safe and heard. So whether that's opening up conversations or noticing changes and talking to kids about what we're noticing, really paying attention and helping them give voice to some of the thoughts and feelings they have is important. And part of that also is helping caregivers and parents also take care of themselves. This is a stressful time. And so I'd really put it out there that recognizing and taking care of oneself during this time is really an important part of taking care of a family's mental health. So if that's reaching out to some of the resources that have been mentioned today, or reaching out to your social network, really taking care of yourself is a part of taking care of your family's well-being as well.
And I would say over the years, I've threatened to write a book on financial planning and always said the title is It's All About the Expenses. So this is a time when you need to sit down and take an honest look at the budget, perhaps take a scalpel to parts of the budget that may not just have short-term implications, but long-term implications in terms of priorities and how you want to live your life.
Great advice from all three of you. Thank you so much for joining me today.
Thank you.
Thank you for having us.
And thank you for joining us. And next week, I'm going to be joined by Rebecca Parton, Project Coordinator for the Dartmouth Trauma Inventions Research Center, and Kathy Bean, Program Manager for the Children's Hospital at Dartmouth-Hitchcock, Office of the Child Advocate, for the final webinar in the series, which will be covering the topics of supporting high-risk families during the pandemic. Let's all work on our budgeting and expenses. Stay healthy and stay safe. We'll see you next week.